Welcome to lesson one of the hip mobility, 7 days of hip mobility crashing in your inbox, and I want you to become a better versed person in your hips and hips in general so that you can go forth and do whatever you want with that information. And to start off, we're going to go over some anatomy stuff, some anatomical words, and that's going to help us communicate better because it's easier if we speak the same language. I've definitely been in classes but the vocabulary was over my head, and that was way too many layers of translation for me to get a ton out of the classes. So we're going to start off with just setting a baseline of understanding about what we're talking about, directions and things like that. And I even have a friend with me to help. This is Larry. I just named him about 2 minutes ago. And Larry, as you see, has a pelvis. Larry does not have legs. Larry's seen some better days, okay? Larry's grabbing my hair. And I'll try not to touch Larry too inappropriately here, but I may, as we get into this backside, of showing you kind of lumbar movement separate from pelvic movement, separate from the femur and the socket. Now, my femur is my thigh bone. Okay, it's the big thigh bone here. Okay, when I say you move your femur, we're talking about this guy, right? And oftentimes when people think that they're moving their hips, they are moving, the hips are involved in the movement, like they're literally moving, but they're certainly not isolated. Like this would be moving from my lumbar. I have to look at where the movement is originating from, okay? So we have, the femur sits in the pelvis in the acetabulum, okay? Sort of like a golf ball on a tee, right? And it rotates through there, okay? And depending on the shape of your femoral head and the relationship of the angle of the acetabulum, you may get different blocks, or you may get different ways, or the way these things are shaped can totally change the way that you sit. So people have a lot of variation, same basic structure, a lot of variation within that structure as to how the acetabulum and the femoral head are set, and which is like a big bony knot here, which leads out into the rest of the femur that sits on the golf tee here, okay? And if you are positioned in such a way that yours are a little bit more externally rotated, or yours are a little bit more straight, or whatever, it's going to change the way that your bones interact with each other, which is how people have such different squats. It's one of the reasons that people have lots of different squats, which you can change based on the amount of variability of movement you have at each different position that you're in, but there is just an anatomical difference, and that's totally okay. So when people say there's one perfect way to do something, they're full of shit, because that would mean there's a perfect person, and everybody's perfect. Shine. But they're not all the same. Okay, so we want to talk about having our motion coming from hips. When I say that, I want it to be from this dissociation, that where that meeting point of the femur and the acetabulum are, okay, not my pelvis moving or from my lower back. Okay? Larry can go over there. Thank you, Larry, for showing us. And so we get into this position here. I'd like to show you a little bit of the motion words that we talk about. These used to piss me off a lot when people would say abduction and adduction. I was like, just say abduction and adduction. Why not? But I can see how it kind of gets a little bit hard to understand sometimes when you're saying it fast. Abduction, adduction. If you're not paying attention, you might lose it. But if you say abduction, maybe you understand. So I'm just going to bounce myself against the wall here and show you. Abduction is when I am lifting my leg out to the side. So my leg is going away from me is abduction. Abduct. I abducted my hip. Abducted. Take away. I guess that I never thought about this before, just now. I guess that's kind of like you abduct. That's terrible to think. Kidnapping is like abducting someone, right? You're taking it away. Take away. All right? From here, we're going to adduct or add it back to the body. My friend Greg Moss taught me that trick. I'm thinking of bringing something in. I'm adding it back to the body. That's adduction. So we have abducting, taking away, kidnapping. We have adduction, adduction, adding it back to the body. And that carries over all the way over here. So if I'm taking an outside leg, right, and I'm crossing here, that is still adduction. It is going towards and albeit past the body, okay? And then abducting, of course, they're relative to each other. If I'm going from here to here, I'm still abducting. The motion is going gradually farther away, okay? On the other side, which way is this? And which way is this? And which side do I have more on? Oh my god, I almost cramped just trying to do that. Okay? So if you haven't done that with me, let's just practice real quick. Stand up, shake it off, leg out in front, abduct, abduct, say it with me. We're going to abduct, and then I'm going to adduct as far as I can. And I'm going to notice if my butt does this. So if you feel like you're shifting all around, stick your butt to a wall, angle yourself as much as you need to, abduct, so you've got some more points of contact, adduct, and that doesn't allow you to shift around. Creating one stable point like that can certainly be helpful. You can even do this on the floor, do a little floor angel here, or abduct and adduct while everything is stuck in one place. Okay, you may feel a little different stretch by doing that. Alright, so other side, just real quick, just to keep it even. Butt is against the wall if you need to, if you feel like you do, if you're shifting all around. Abduct, adduct. Okay, enough of that. Rotation. So when I'm talking about rotation of the hip, I want the femur rotating. I'm not talking about rotating the back. That's if we're training the back or we're training pelvis stuff. So if let's start off with this. You're going to put your heel on the floor. So I have a closed chain. You have an object to pivot off of here, and I'm going to rotate my thigh. You can think of pointing your knee with a straight leg as far in as you can. That's your internal rotation because you are rotating towards the inside. Okay? You could also do some construction. And you have the force here, and you're using your hand to rotate, so you're mimicking it on top. So you've got internal rotation of your shoulder, glenohumeral joint, as well as internal rotation of here. Now notice that my butt didn't follow. I can create this on two different ways, right? I could create this by bringing my pelvis over there, and my pelvis relative to my base leg is now changed, but it didn't change if I'm thinking about this leg. The relative position of my pelvis of my femur in the socket did not change. This is actually a great example. So if I'm here, pelvis, femur, they're still moving in the same line. However, my base leg, since I have a fixed point of my leg, as I rotate this way, but my femur still pointing that way, I now have an internally rotated femur. Ooh, check that out, okay? So I don't want all the shaky bits here. So again, you can always pin your butt to a wall and work here so that you don't have that motion. You can feel whether or not you're rocking back and forth like you're on a ship, okay? So here, the heel, back and forth. This is step one. Introducing. So hold it for a few seconds all the way in, and then rotate all the way out. Again, notice that you don't follow the other way. Your hip doesn't kick out. This stays still. No booty shaking. Okay, now pick your heel just slightly off the floor. So you've opened the chain. Do the same thing. Watch your thigh rotate as far as you can one way, and watch your thigh rotate as far as you can the other way. This is still internal rotation when you're rotating so that the knee ends up pointing in, and external rotation so that your femur bone ends up rotating out. Okay? Let's do that on the other side. We'll keep it simple right now. Heel, external rotation, the femur in the socket. Internal rotation, femur's in. External, internal. Everything else stays still. External, internal. Lift the heel off. External, internal, external, internal. Now, let's do a little bit of abduction in, and from here, can you do the same thing? Let's start off on the floor. So I've abducted my left leg, and I'm going to rotate externally and internally. I'm working a little dorsiflexion of my ankle because my ankle is made into a hook. The rest of my body isn't following. I'm not wagging my tail. No tail wags. Just practice here. This is getting a ton of feedback of the nerves in your joint capsule, which is a super important base layer of your joint. We want all those nerves to be super aware of what's going on. It helps you determine where you are in space. And let's try off the ground now. Rotate in and out. Can you do that without wagging? And if you can't, you can come back to a place where it feels a little more natural. Okay, let's try that on the other side. So let's try adducting on this side. Adduct, and then internally and externally rotate. Noticing what you feel. Okay, and we've been 3D, but a little bit 2D here. I want to add another element to this. Once you put a bent leg in the position, it gets a little confusing. So I'd like you to stare at your thigh. Go with your straight leg again, and stare at your thigh and look at the motion. Internally and externally rotating. Then, bend your knee and try to make your thigh do the exact same thing. If you're running into your other leg, you can bend it at a different angle. And just pay attention to your thigh. You can even kind of cut it off here. I don't want to see anything but this rotation. It's the same thing you did. But a lot of times when I say do this, people just wag their knee into hip abduction and adduction. So I'm pivoting off of one point. Another easy way to do this is to glue your knee to the wall and bring your heel out from side to side. So you're just pivoting in the socket. Two other words we're going to talk about, flexion and extension here. So I've got adduction, abduction, internal rotation, external rotation. Internal rotation, remember, it's about the bone. So if you're ever curious, straighten it, internal. Okay, if I bend, it looks like that. Straighten it, external. If I bend, it looks like that. Okay, and then we're talking about flexion and extension. So when I bring my femur forwards, this is flexion of the hip. And again, notice that I could achieve my knee in front of me by tucking my pelvis. That's not really what I'm looking for. This stays still from here up, flex. Then when I go to extend, I could do that straight leg too, straight leg flexion. And then extension is here. Almost none of us have true hip extension. True story. And you'll see my back kick in real quickly, trying to help me out here. So one of my favorite ways to do hip extension is actually on the floor, driving my hip bone into the ground so that I can feel that motion. The one other thing I want you to pay attention to is the feeling of closing angle versus opening angle before we end our basics lesson for today. If I bring my knee in, this is a closing angle because this angle is getting bigger and this angle is getting smaller in my compass here, okay? When I start to open this way, now this angle is the opening angle and this angle is closing. I would like to feel things, ideally I'll feel things on the opening side angle. So the restricting tissue will ideally be the back side, feeling a stretch, versus things running into each other on the front side. Doesn't always happen. It's not the end of the world if it does, okay? Same thing this way. I would like my restriction to feel like it's this side tissue when we get into there, okay? And same thing with any of the other angles that we do. I want you to understand that the limits, when I train people, the limits of your mobility, so your end ranges that we're looking at, you have at least three categories. We have whether or not it's opening and closing angle, but we also have pain, okay? We have pain or discomfort. When you're just starting out, I'd rather you just err on the side of caution for discomfort until I'm sure that you trust yourself and I can trust you about what pain feels like. So we're just erring on the side of strong and stable and feeling good. Do things that feel good. That's our first thing. If I try to move my hip and I go, ow, okay, I've hit my end range before that. That's not even the end range. The end range is before it hurts, okay? And if I start to feel obviously, there's also active range of motion, okay? If I have to lift my leg to here, and then when I drop it, I can only hold it to here, that's my active ability to engage. And my friend Moses talks about all the time, if you have the gap between those two things, a big one, you may have a good 20% difference between the two of those, and that's totally fine. We can close it a bit, but you're usually going to have some difference. Almost always going to have some difference. If I can pull it to here, but my active engagement is here, that's like having a car whose brakes don't work for this last 20%. Like it goes to 100 miles an hour, but your brakes only work to 80. Okay? And there's where you're strong. So even though I may be able to lift it to here, maybe if somebody pushed against me, I kind of drop down to here. So there's a curve this is called a strength curve, right? So I am weak at a certain range, I get strong at a range, and then my strength starts to come down at another range, okay? So we're looking to flatten that as much as we can by strengthening the end ranges to come up. But it's easier if I start, let's say this is the full range, instead of starting right here, I might start a little bit farther off of my absolute ability so that I can start building this guy up, and then we can keep building outwards using that strong base. Right? So there's been your super brief introduction. Abduction, adduction, internal rotation, external rotation, flexion, extension. Okay? The difference between your pelvis and your femur, and being able to identify that. If you go do, for the rest of the day, your job is to do as much of this stuff as you can, because we want those nerves to be super awake and aware, and we want your ability to identify where your hip is to be super all in. Just doing that rotational motion for the rest of the week. So go ahead, that's your homework today. Do this, and whenever you find yourself standing up and around, make this be your thing. Okay, have a great rest of your day.